What are those real patient frictions? What are the operational gaps? And what's the difference between a conversion that looks good in a dashboard and what actually turns into real revenues?
The industry average is around 26% are no-show appointments,
Oh,
right?
wow.
So the highest we've seen is actually in the 30%. The lowest I've seen is just around 15. We average less than 5%, but that is by the way of like we're managing the patient journey.
I'm always fascinated by how it's so small and so subtle that these little changes, right? But they make huge impact on the patient experience overall.
We're putting homework on the patient, we're putting them
Mm.
expectations on them in advance. If I'm also not really sure that I want to have this procedure, why would I do the homework? It is speed to lead. Whoever responds first is the one that receives it.
Well,
We were the 12th one, but we called them in under 20 minutes. And so she said, I'm going with you.
hello, everyone, and welcome back to the Healthcare Website Playbook podcast. I'm Brad Munch, your host, and I'm also the CEO of Symetris. We are a digital agency who helps healthcare organizations maximize the value and the lifespan of their existing websites. Now, today, what I wanted to talk about was about how to design a website for show-ups and not just the sign-ups or the conversions on the website. Because right now, in the world that we're living in, we're focusing a lot on how many conversions, how many people booked that appointment. And there's this gap that healthcare marketers know exists, and sometimes they don't have that much insight into. And that's basically what happens between that sign up and the actual appointment being had. And that's when the real world kicks in. So that's where there's questions, there's delays, there's paperwork, there's bad handoffs, etc. And there's a lot of value that leaks out there. And the person I felt was really the most valuable to speak to for this type of insight is Jessica Walker. She is the founder and CEO of Sherpa. She has spent years working on the part of the patient journey that most marketing teams barely get any visibility into. This is what happens after that lead comes in, before he shows up or she shows up and moves forward. And that gives her this very practical lens into what are those real patient frictions, what are the operational gaps, and what's the difference between a conversion that looks good in a dashboard and what actually turns into real revenue. So, Jessica, welcome to the pod.
Thank you so much, Brad. And I'm so excited for that conversation today because it all just fits in so perfectly.
Great. And so I kind of quickly introduced you, but maybe, I don't want people to take my word for it. I'd love you to kind of speak for yourself and tell me about your journey and why your point of view is so valuable here.
I appreciate that. What's funny is I've spent 20 years in this last space of patient engagement research and patient engagement tactics. And like you, actually started an early part of my healthcare marketing career building smart websites and how do we do targeted marketing, right, in a way that gets the right audience at the right time and gets them to engage with their message. What happened though, as I worked with my partners and time again, this last mile of what happens between the click and the consult is where the gap was. And I went out into the world to try to find a solution for my partners, and there really wasn't one. But my background in hospitality and my service mindset knew that this is the most critical decision point. And so that's what, Sherpa is all about, is helping that last mile from the interest to actual consult to procedure.
Okay, so that's really, I think, the essence of what we're trying to talk about today. And what I would like to try to figure out, and from your perspective, as you said, you had difficulty finding organizations that can help with that part of the process. So why is it that healthcare marketing teams, they put so much weight on that conversion, on that sign up, and when a lot of that story basically happens after the sign up and between that and the appointments? Why are healthcare marketers, in a sense, blind to all that stuff that's happening after the conversion?
Well, I'd actually say they're not blind to it. They're very aware. They just don't have the control over it, right? So you think about that, they're responsible. What they're held accountable to is the metrics that matter. And the metrics, from a health system looking at this budget spend says, great, did we get more new patients? And so that's the measure they're tracking. However, it's operations that is the baton holder, right? Marketing gets them to the website. Marketing gets them to get to the call to action, but then they don't control the process from there. And so that's why, we serve marketers to become that insurance policy on their campaigns because they can't change operational friction points. They can't change, they don't control the resources. But that is the most, I would dare say, the most critical factor in success of a marketing campaign. So, hence, like I mentioned, there's call centers, there's chatbots, there's other things out there. But yet, because it is a human powered buying decision, that's why we've represented a solution that offers that up. So marketers aren't blind to it. They just don't have the empowerment to do anything about it.
And I've seen a lot of conversations around, you want to go from awareness to booking that appointment to the
Mhm.
revenue. And what is like, do you have a rule of thumb of saying how many percentage of appointments that people book are actually there's no shows?
Oh my gosh. Well, the industry average, so we, studied across multiple elective medical procedures, right? And so these are, again, you book an appointment, whether or not they come. So the industry average is around 26% are no-show appointments,
Oh
right?
wow.
So the highest we've seen is actually in the 30%. The lowest I've seen is just around 15. We average less than 5%, but that is by the way of like we're managing the patient journey. So ultimately, however, I believe fundamentally that you can get someone to commit to an appointment, you give them an online scheduler, you say, oh, they're going to, but just because they click that button and they, make that appointment commitment doesn't mean they're going to show. They don't understand the why, they don't understand the value, or you haven't addressed their concerns or their fears. So those are the things that influence no shows that can make a difference. That again, marketers aren't responsible for that necessarily. They don't have the ability to control that lever.
Right. So you're saying basically that you can divide by 5. Is that what I'm saying? Or multiply by 5? Or like,
Yep.
going from that 25-ish to about 5%,
Mhm.
drop off rate and between the booking and the actual shows. And so
Mhm.
what have you seen, right? What are you pushing
Yeah.
on or influencing during the work that you're doing that makes those people show up? So what are the items,
Yeah.
basically the frictions that are influencing the no-shows in a sense?
I'm going to split it into a couple categories, right? So let's start with, we'll call it like operational friction. This is the most common things that I see with healthcare providers where we're putting homework on the patient, we're putting them
Mm.
expectations on them in advance. Hey, you have to have a physician order. You go get that. Hey, you have to fill out this paperwork. You do that, or we're going to cancel your appointment. Hey, you have to show up in this environment and this time and do this check-in process. So those are important to us as healthcare, in healthcare because we want your records, we want the order.
All right.
But yet, as a consumer, you're putting all this friction points on my journey. And so,
Right.
candidly, if I'm also not really sure that I want to have this procedure, why would I do the homework? So that gets into point number 2, which is hesitancy. So
Right.
if I am uncertain, if I am afraid, if I am questioning your credibility as a provider, anything that gives me pause around whether or not I should do this, then it's
Right.
easy to talk myself out of making that investment,
It's like a
right?
bad signal, right? Yeah.
Yeah, exactly. And then the third category I would say too is like it is this, and I'll call it what it is the experience. How did you make me feel? If I call in to book my appointment and I hear literally, this is a mystery shop we just did 2 weeks ago. You call and they say, doctor's office, what's your date of birth? That's how you're greeted.
What? Okay.
Right. Because they're in a scheduling mindset, right? They're in this
Right. Right.
transactional mindset. Shift that to you call into a team that, we work with, which is like, hi, this is Jessica. Who do I have the pleasure of speaking with today? Like, and then
Hello.
I, right. And you say, I'm Brad. Brad, thank you so much for calling. How can I help you? Right. And just start a conversation. I'm putting you at ease. I'm giving you warmth. I'm giving you connection. And then I'm showing you gratitude. It's a subtle thing, but the signal I'm sending you in that moment is like, you're important to me enough to know your name, enough to like engage with you as a human. That changes your psychological mindset. And we've seen that actually changes who you decide to go with. And even to the point of it costs you more money or it's less convenient because of the way that you've made me feel. So those are the 3 things I say that, makes a big difference in that last mile, that if we're not accounting for those, does put the ability to have more no-shows and frictions on the show.
I'm always fascinated by how it's so small and so subtle that these little changes, right? But they make huge impact on the patient experience overall. And it's not, and because I've never encountered a health system or hospital or who's like, oh no, patient care is, our priority and it's so important, blah, blah, blah. But then when it kind of, the foot hits the ground, you have these situations where, and again, it's not always because they want to be mean. It's just like they
No,
have so many calls to field or whatever it
exactly.
is. But there's such small, subtle nuances that can make or break that experience, right? And that can
Exactly.
directly affect revenue.
Yeah, and I like to, one of the things that, so we work with practices of all sizes, from health systems to private practices, et cetera. And one of the things that we just start with is that question of how are you treating, especially your new patients? You spent
Mm,
all this money to build a beautiful website. You spent all this money to do some targeted ads. You spent all this money to like get out and get content out there. So now you finally have my attention and I call in, but now I'm in a waiting queue and I'm on hold for 10 minutes,
right.
literally, sometimes if we had longer than that. And so the first thing, and this is what your listeners can take away, like if nothing else, separate out the new patient experience. That just like if I were to go buy a car, if I showed up for servicing my car versus buying a car, you're going to make sure a salesperson is there immediately to help me, right? Because that's a sale.
Right.
Let's do that same thing in healthcare. Let's VIP you, get you the red rope line, and get you off in a separate experience. So I know somebody that has the time and the focus is going to answer my call or respond to me. And that's, again, a different shift of mindset of treating patients, and especially our new patients, in a different caliber. That's an insurance plan on your investment.
That is so. It seems so obvious, and it. What's fascinating about it is that it also is something that is not that far off to implement, right? Because a lot of the
Exactly.
booking systems that people use today, they
Mhm.
ask you in the process, like, are you a recurring patient
Mhm.
or a new patient, right? So it's very
Right.
easy to get that info. So it's not that
Fantastic.
a huge
Yep.
lift, right, for the teams just to adapt to that. That's really
Well,
an easy
and
win.
I've seen this already as well. I mean, again, you see this in other industries, right? So you go to like the electronics industry, the car industry, et cetera. As soon as my phone number or my, email hits your domain, you already know because you're tied to a data enterprise data
Right.
warehouse, right? And again, I get that most providers don't have that level, but so if you don't have that, that's a good use of AI. Having that like, hey, are you a new patient when it answers the call? Or you have a tier one person that, greets you and gives you gratitude for calling, but then that's their first question. So there's just ways to do this that are everything from advanced to just very old school.
Right. So we talked about the hesitancy. We talked about the overall, I guess, managing expectations, patient
Prioritizing.
experience, part of that, and the operational friction, like overall, the forms are kind of pushing all this homework over
Mhm.
to the patient. And so that's what you're seeing in your that you're able to address to reduce that loss in the
That
conversion,
delay
right?
factor. Mhm.
Right.
Yep.
And so what can we do? Because now, like as organizations too, as you're mentioning, we all have and we both worked in the website, how can we take these lessons, right? And say, okay, well, these are the things that are happening after the conversion. And
Mhm.
how can we take lessons from that? Or what could we adapt to say, okay, well, based on that, maybe we should do this
Mhm.
on the
Yeah,
website. This could really help or answer questions that people we know they're going to have or
absolutely.
reduce that friction before it actually happens. So, what would be the number one or a couple of things that you would identify
Yeah.
as being, hey, if your website did this, this would be a game changer?
Yeah, absolutely. Let me throw you a couple things. So when we engage with a new client partner, we'll go in and do an experience audit. So we literally
Oh,
shop you as a mystery shop to say, I'm a new consumer. I called you. What was my experience? I went to your website, fill out a web form. What was my experience? I came in through, whatever means and calls to action you have out there. So let's focus on the website kind of conversion path today. So
right,
I consume your content. Of course, like I sure hope you have a form on there that says, hey, request an appointment or request more information, right? So that is your conversion call to action. So within that, of course, we know the best practices of get my name, get my phone number, and get a way to contact me. But even a subtle signal that says, what's the best time of day to contact me, right? Or even
wow,
opting in to say, how should you contact me? Would I prefer an email? Would I prefer a phone call? Would I prefer a text message? Let me opt in that moment and tell you how to get a hold of me, time of day, and the best channel. Those little things alone, you're already telling me that you honor me and my time and be able to accommodate that. Now, this is radical and this has nothing to do with a beautiful website and a beautiful web form. But the last thing I would say in this category that the best practice is respond to these inquiries. I know that's crazy, but in
yeah,
our research, it's 72 hours or more before the average
really,
healthcare provider responds to a web form
man,
because we're giving it to Sally at the front desk on top of her other duties. Right.
right,
So then it's Friday, it's 3 o'clock. Okay, fine. I'll finally go through those if I have time. And now she's got to sort through her email and she's got to. So another thing that we work with our partners on is like at least give an acknowledgement and an auto email. Thank you so much for
right,
your submission. If you have questions and like a faster response, feel free to call us. Like let that person opt into calling you too. Right. And again, you're acknowledging that their submission existed, that someone's going to, and giving them expectation setting. So If I were to wave a wand, my preference would be, we call it the speed to lead, right? So the moment that web form hits, the clock is ticking. And it is speed to lead. Whoever responds first is the one that receives it, right? We literally just
This
had
is
a patient, just a quick story. We had a patient today tell my
yeah.
Sherpa that they contacted 12 clinics that they were interested in talking to.
Well,
We were the 12th one, but we called them in under 20 minutes. And so she said, I'm going with you. You've actually responded. And like that's as subtle as it is. But again, we've got to dedicate, operation resources or somebody to make that call.
right. Yeah, I think that's a challenge that we're having in I think the healthcare industry in general, right? Where I often compare it to all the other, be it airlines or whatnots. You were talking about
Yep.
car dealerships or whatever, and the patient for us, right, is the customer for them, and they, pull out all the stops and the stuff that you're recommending here. They're not like there's this book like Unreasonable Hospitality or whatever,
Yep.
where it's like
Exactly.
really going above and beyond. But this is, for
Basics.
another industry, this would be table stakes. Like just send them an auto
Absolutely.
reply, right?
Mhm.
Ask them, as you mentioned, like what time to, should I call you back or whatever, or prioritize a new patient. So this is really, I'm always mind blown by, where the weight of the priorities are put, because these are so small. They're very low cost changes that can be made, but they can have a huge impact overall, right, on the patient
Yeah.
experience.
And I think it's a mind shift in healthcare because we've always had this thing, oh, we're just here and you need healthcare, you're going to show up.
Right.
And so the clients that we work with recognize that this is a very competitive landscape. You have one moment of truth, right, to be able to move me forward or not. And so if you shift this mindset, so use the example of your cable company, right, back in the day when you had to sign up for internet or cable,
Right.
that's the first thing they ask you. It was like, if you're a new customer, I'm going to VIP prioritize you to my top tier agent because I want to close your deal. And so, we look at this to say you have to, if you want to be competitive, if you want to be revenue positive, you have to prioritize this. And you don't do it by just telling Sally at the front desk to work harder. You carve it out as a specialty focus, and that's how you win.
Right. And so we were talking about that form, right? The after the email, just kind of acknowledging it.
Mhm.
One thing that comes to mind on my end that is about having that page on the website that says, what to expect, before your appointment, how to, manage, get to your specific clinic, if they can give you some little indicator on like what building we're in, right? And how to, where
Mhm.
parking is and stuff like that. So those are also, I feel, little cues that can help. Are there other places apart from where that form is and the actual interaction in the form? Is there any information that a hospital or health system website could provide to visitors to help them navigate the post conversion?
Oh my gosh, yes. So, another subtle thing that and we think about this if we put our patient experience hat on, right? So if we remember that no matter the service line, there is a level of anxiety, there's a level of
Yeah,
anxiousness. So how are you going to be conveying trust? How are you going to be conveying that, I can have confidence in you as my provider? So
right.
there's everything from make it easy for me to show. So, we've worked with client partners to give very explicit arrival details like, hey, Brad, when you arrive, here's the best place to park. And then when you walk into the building, look for the yellow sign, whatever this is. But just take the time to build that out. But the other thing as well is like, hey, before you meet with Dr. Jones, I wanted to send you his physician profile video. I mean,
That
you've
is
already
great.
you've already built the content, right? So how do I want to humanize Dr. Jones before you arrive. So again, I trust you, I have a perspective. And then another thing too is like you may find these educational resources helpful. These can all be automated communication patterns. But again, you're differentiating yourself from your competition and putting that out there. And candidly, you're also pushing them to your web for additional content, right? So if you've got,
Right.
in the future, they can trust your site as a trusted source for post-discharge recovery information or, other kind of education information. Again, you've invested in it. Why not promote it?
I again, like it seems like every suggestion you have is
Mhm.
so obvious and logical and not that much of a lift, right? But
Nope,
it's just you have to think about it and just take the
that's
time
it.
to do it.
Yep.
And yeah, it's just I love it.
Well, and I'd say that you hit the nail on the head earlier, which is this comes down to the work that they've done with you to build a beautiful site, to build the content, put it out there, and now if you put yourself in that mind share of a new patient consumer, how do you just leverage it? But it's somebody has to focus on it and help you deploy it.
Yeah, and I think that, and again, since the incentive is so much on getting to that conversion, there's maybe less attention for the marketing team to put on the post conversion, on helping that
Yeah,
flow, or reducing the number of calls to the call center or whatever or
right.
whatnot, because these are sending that email and saying, so you booked in heart care or something. Well,
Yep.
it's very easy to say, like, this is, just go back to our page, explains to you like our approach to that. It is such an easy thing to do. But then if there's no value attached to that, right? Then
Yeah.
I'm going to be focusing on, I have to create a new ad or A/B test this ad to get people to come to the website, right?
Yeah, it's we talk about it where it's at the top of the funnel. How do you get folks in to get interest? And I argue that throughout the entire funnel is where your revenue leakage is happening, and definitely here at the end. I mean, that's the problem in healthcare. Is this a patient experience issue? Is this a marketing issue? So again, who's owning it to make it happen? To really understand the journey and where the gaps and the friction points are. And that's where we can demonstrate that these things do make a difference in conversion. But it's takes the time for someone to be responsible for pulling the content together and offering it to the patient.
And so how do, like, have you seen examples where the operations team is working hand in hand with the marketing
Oh
team
yeah.
to get that stuff online and or make that journey
hmm
simpler?
without name dropping some of the health systems I've seen this work best in, there is where marketing and patient experience are both aligned, right? And
Hmm.
they both have a rep. And then they also have a tech rep that's in there too. And it's like a task force, I guess is the best way to say. But that's where, no marketing campaign is done without the operationalization. Patient experience is involved in looking at it from like a clinical outcome perspective as well. Because you think about this example we talked about, and I have a health system right now. What started, they had said to me like, hey, we have so many patients that are in process. We don't know why. So we went and audited their calls, we listened to it, and we codified it. And what we found is that because at the point of booking the procedure, nobody talked to them about your policies around what to arrive with. Nobody talked to them about this. So they're getting a lot more inbound calls that could have been handled up here, but taking that time. So that came from patient experience and marketing and us coming in and auditing it. So that showed the volume, thus opened up the call lines more and allowed more new patients to get through because now we've got, better call handling. But all that comes together from having joint task force thinking about the journey.
Right. Yeah. And I think it's in certain cases, it feels like a luxury to have that kind of patient experience person. Or I've seen systems that actually patient experience is owned by marketing, right? So that's even
Yep.
easier to kind of get all the way there. But from what I've seen is that's mostly the exception, right?
Agreed.
And so
Agreed.
how do you feel that, how do you see that relationship developing, or getting to have someone who's looking at every kind of, even on the
Yeah.
post conversion side, like, what, as an organization, how would you push for that?
Well, I argue that it comes from, we have a lot of feels. So we feel like this is the case, but we got to get the reals, and we get the reals
Okay.
through data, right?
Okay.
And so
Sounds
ultimately,
like the tagline,
it
but that's
is
good.
kind of maybe something I've used in ways, but it's true. So like for us, we are an analytics forward group. So I want to everything about the pipeline, the journey, we're going to understand it. So the marketing partner, if they're accountable for new patient appointments, consults, or procedures, but then how do we start to track all part of the journey so that the marketing can come and show, hey, we've got a 10-minute average hold time when someone calls in, asking a question, or we've got this. And then that's where you can bring in the task force or help create it. And of course, like the other side, we argue is that we know it's a macro problem in healthcare, but just start micro. So I'm working with a health system right now that we're working specifically on their TAVR cardiovascular patient journey, high
Right.
value opportunity, but then it's really showing on a micro unit these friction points, right? So then you can learn these lessons. And then ultimately, that's because that marketing team was hand in glove with operations and with patient experience to bring these things forward.
And is there a way to, because I feel that the overall experience can also be impacted, because we're saying it's a bit, out of the hands of the marketing team, because once the
Yeah.
operations kind of get into it, if there's no patient experience. But there's also, I think marketing also sets in the way they're wording stuff and the way it's
Yep.
presented on the website.
Yep.
There's they're setting an expectation, or they
Agreed.
are alluding or letting it vague, right? Because even if,
Mhm.
like you were saying, that example earlier of someone calls up and then within 72 hours they got called. Okay, so let's say that in today's context, this specific, hospital or whatever doesn't have the bandwidth to be able in the short run to deal with that. But
Mhm.
at least if you're in your form saying, hey, fill out this form, we'll get back to you within 72 hours, I think that's a
Mhm.
good expectation to set, as opposed to having the patient assume that, well, I'm guessing they should be calling me within the next hour, right? Because I
Mhm.
just filled in the form. What do you feel about, you know, setting expectations like upfront, even if they are maybe
Yeah.
not as, ideal as,
I'd
one would
rather
like?
have you be honest than try to, it's that whole thing, right? Be proactive and be honest. If you know it's going to take 72 hours for us to get back to you, set that. But then also have on your landing page post submission, if you'd like faster service, please feel free to call us, right? Like that's a
Right.
simple thing too. But I'm going to actually go a step further upstream, Brad, that what I have seen well with, I'm thinking of a specific fantastic chief marketing officer from a health system in Louisiana. One of her things that she has done is that she will not even deploy a marketing spend unless there is a demonstration that there is downstream handling. And she's
Right.
gotten the backing because she basically said, I'm just flushing money down the toilet. These are going to go in a black hole and we're not thinking of the end in mind. And so then that forces the conversation more proactively, right? Instead of a provider, a doctor saying, I need, spend money on my marketing. She says, great, I want to. Show me that you're ready to handle, this process. And so then
How
if you're
did like
not,
explain? Sorry, can I
yeah,
interrupt you 2 seconds
yeah,
on that? Because I know that there's a lot of the conversation about this is about, I think people are getting to the point where they're saying, hey, we have to have the access, right? So if we're
mhm,
going to have appointments being booked, we
yep,
have to have access, we have to have availability
yep,
for those appointments. But it seems you're going one step further to make sure that, that CMO you're talking about is making sure that the actual experience to getting to that appointment is also quote unquote worthy of her
ready,
dollars.
that they're ready. Yeah. So it's like, is someone going to answer the darn phone? So we work with a health system in California where they make a 48-hour second opinion pledge for their cancer patients, right? They
Wow.
are advertising that, they're making that service level agreement they're putting it out there. And so
Right.
they knew operationally that their current team and structure, didn't have that nimbleness. So we
Hmm.
were brought in and we are 100%. We chase the orders to get chase the records, chase the orders, and then we make sure that the capacity is there, so either from blocks being held or us chasing and finding the opportunity, but that patient is seen in less than 48 hours because of that. So it is, like you said, if you're going to put that marketing message out there, you're making a pledge. I don't
Right.
want you to set
Promise, right? Yeah.
expectations if you're not going to be ready to deliver versus setting that up. So it's intentionality, and it's also having that alignment. And I know many of our marketing friends are very frustrated. They'd love to do more, but again, without having that resource and that ownership of it, their hands are tied.
Right. Cool. So we talked a lot about, the challenge, the friction that we're seeing, how that impacts the overall revenue, how,
Mhm.
we can improve on our websites and the overall relationship with marketing and
Mhm.
experience and operations. What do you see like in the world today? And, like I think it's impossible to have a conversation on the podcast these days without,
Mhm.
addressing the AI situation. And there's also the whole, you were talking about a lot about dashboards and the attribution and the KPI. So how do you see this evolving moving forward? Do you see AI be something that can help us moving forward with this? Or is it more about, those kind of quick steps that you were mentioning and that human element is super important? How do you see this
Yeah.
evolving?
Well, I mean, from my view of the world, I think that there's a ton of opportunity for AI to help when it comes to some of these mundane transactional parts of healthcare, right? So, specifically, we're working on a tool right now that helps order chasing. So I don't think it's appropriate to put it back on the patient to say, oh, I have to have this. So, for an example, I had to schedule colonoscopy recently, right? And I was told by the health system, you have to call, get your order, then you call us back. So what we're working on is a solution where AI could go and make that call on our behalf, right? Low stakes and whatnot.
Right.
So things like that. Then you've got the human in the middle. So if the AI can handle the basic things of like, hey, I want to request a prescription refill. Hey, I want to, have a question. But then now what's going to happen is if the AI can only go so far, and then I need to have a human, right? A human that can be more educated, more informed. So those are some areas that we see in addition to like work that you're doing of how do you create an educational journey AI, right? If I have
Mhm.
specific questions, it can offer me insights and information that helps me feel comfortable enough to now say, all right, I'm ready to talk to a human and take the next step.
Right, and that's when we're putting AI, I think, in the closer to where the patient is, but that
Mhm.
kind of mundane task, and I think you even alluded it to it earlier, is right. How do we identify that this is a new patient versus
Yep.
existing patient. And these kind of algorithms are, we can call them AI at a certain level, but there is a lot of optimization or
Yep.
placement in different dashboards or whatever that we can use. And so
Absolutely.
I agree with you. There's a lot of potential client, or I mean, patient facing AI is always kind of like a big question mark because we don't want to give any
Hmm.
bad or hallucinations or whatever.
Yep.
But yeah, I definitely think that there's some way that we can, provide non, um, you know, quote unquote dangerous information just to help the patient along
Yeah.
the path. So
And
that's for sure.
we're deploying with a health partner right now where, so we talked about earlier, when do you send me content to remind me this is the doctor I'm meeting with? When do you send
Right.
me content to remind me this is how do I prepare for this procedure? So that, instead of using human power to go and know where I am in the phase and stage of the journey, having the AI that tracks that, understands it, and then timely sends that information to you, right? Those are, I think, are great ways of the future of just supporting the patient journey that doesn't require humans, that is a repeatable process, but you have the AI to be able to read the record and know this is the right time to send Jessica this information.
Yeah. All right. So helping the orchestration of that message and the
Yeah.
timings of all that. Yes, that's true. Right. And so we did get the to address a little bit of that. So based on everything that we've been talking about today, as we kind of wrap up the conversation, what do you feel from your experience and everything we've spoken about? What would be if I'm, I don't know, a marketing manager at a hospital or a, multi location clinic or something, and I want to be able to improve on this post conversion experience. Monday, what should I be looking at? Or is there some kind of small step that I
Yeah.
can try to make that would provide the best return on my buck?
So I think it's kind of some of the things that we said, which is like, regardless of who you are and what your budgets are, it is start small. Ask me when's a great time to reach me, right? And then ask me what's a great channel to reach me. Because also we don't want to make our web form so bloated that, they get caught in a big survey. Those are simple though. At least, then you're respecting who I am.
Right.
And then I think it is be honest about what your current response time is, and then give me another path to be able to get there. At least you've collected my information. The landing page says, great, we're typically back to people in 72 hours. For faster service, please call us here, right? And then again, you could make that a special new patient line number, like, and
Hmm.
separate that out. Make it ring differently at the office, whatever the case may be. Basically, anybody that has a website that has basic tools can deploy those solutions right away.
So, I agree 100% with what you're saying. But as you're speaking, I'm thinking of, even higher up than that, and maybe it's maybe too obvious, right? Because we're talking about these things that seem too obvious, but just kind of going through your own process and seeing what
Mystery shop
happens.
yourself.
What email are you going to receive? Like, as from a patient perspective, what are you asking
Yep.
at? Like, what
Yep.
would you like to find out? Or
Yep.
ask someone maybe because there's always that bias because you're within, you know what to expect, but just ask a friend, right?
Yep.
Or go sit in the
Yep.
waiting room and ask someone,
Oh
how
my
did it
gosh.
go? Like, did the booking experience go well, kind of thing?
Well, I'd even go even further. I mean, that's why we mystery shop every practice before I even talk to them the first time. I want to see what
Right.
your experience is today. And so, yeah, the marketer I told you about, the chief marketing officer, as soon as they get a request, that's the first thing she has her team do is go through the digital patient experience today and say, are they ready for our help? If we're going to turn on the spigot, like, where are we at? Right. And measuring what that patient experience is like. So those are things that are very telling. And, so like I said, when I call in and you say doctor's office, what's your date of birth? Like, okay, can we, think about it differently? So yeah, these are not elaborate, costly tools. These are the basics of blocking and tackling, but putting a different lens on that says, what's the experience for our patients? What's the first impressions we're setting? And what are the subtle cues and clues that we're setting for them about how trustworthy, credible, and service-oriented we're going to be?
All right, that's great. And so in closing, like what would like based on everything we've said today, if there's one takeaway that you would want a healthcare marketer to have from what we've spoken about, like what would that one thing be?
If I were to wave a wand and give every marketer like the best thing, I mean, for me, how can you separate out, you spent all this money to generate this demand.
Right.
How can you separate them out as a different kind of pathway, assignment, resources, so that we never lose any new patient interest? That'd be my, like, let's do that. So, and that subtle thing, just it's a cue and a clue, and we know that there's someone paying attention. makes all the difference in the world.
Fantastic. Thanks, Jessica. And so if people want to find out more or want to reach out to you, like what's the best way to do so?
Yeah, I would love to meet you on LinkedIn. So it's Jessica Walker on LinkedIn, Care Sherpa. Look for the alpacas. But also Jessica at caresherpa.com. Would love to reach out to any. And hey, I'll tell your listeners, we are happy for a no obligation mystery shop. I'll have my team mystery shop you and your 2 closest competitors and tell you how you rank. I would love doing that work because, by the way, we're collecting all this data around what's happening in the state affairs for healthcare.
That is a compelling offer. Thank you, Jessica. And thank you for joining the podcast and sharing your insight. This was great.
Yeah, my pleasure. So much fun, Brad. Looking forward to another one in the future.
Take care.
Bye.